Hello, welcome, and thanks for joining us to help choose home when care is needed, a podcast all about the benefits, value, and safety of receiving care and services in the one place that feels most comfortable, wherever it is that the person needing care calls home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. Before we meet today's guest, a brief thank you to our sponsors and partners, the National Association for Home Care and Hospice, Access, and Core Cubed. Today's episode is number 3 of season 4. Our guest today is Sheila McMacken, a licensed clinical social worker, founder of Wellspring Personal Care, and the founder and past president of the Home Care Association of America. Please help me want you and welcome Sheila McMacken to Help Choose Home. First, let me say, Sheila, what a pleasure it is to have you on this call today, because I think I shared with you, you were one of my first guests 4 years ago when we started the podcast, and I believe you have actually had more listens than any other person in the podcast series. So congratulations.
Why, thank you. It seems like quite an honor, I guess. I hope they were listening and thinking good thoughts.
I'm sure they were. The information was very good. And I'd really like to catch up because in the 4 years since we have talked on this podcast, a lot has changed in the industry, primarily pandemic and COVID. So for our consumer listeners today, how would they go about searching for home care in a post-pandemic world?
Oh, yeah. That's a big question, Marilee. You know, if you'd asked me this question 2 years ago, I would have said X, Y, and Z. Nowadays, I think it's becoming more and more of a challenge. But I will also say that what I've noticed in the calls that we're getting in my agency at Wellspring, that consumers are becoming much more savvy and are aware. And, you know, they'll say things to me like, you know, they'll say, listen, I really need to know the questions I need to ask you, which is unusual, I think. I haven't experienced that. I think that the first place to start is really to understand in your state what your licensing regulations are, because I think that can be a really helpful beginning. And it should be relatively easy. You know, Google who licenses, what state agency licensed home care in Illinois. And what that'll bring up is the Illinois Department of Public Health. And when you go there, they have, you know, a table of contents that allows you to go on and look for Illinois. Our license, we have 3 levels. The service, you know, home services, home nursing, and then home health, which is obviously the Medicare, Medicaid section. And there's a table of contents of the listing of all of the agencies that are licensed in Illinois. And there's a description that explains what the 2 licensure levels cover. And so I think that that's the first place that I would recommend any consumer go to, would be to really make sure that you have a handle on how in your state home care, how it's governed. And make sure that and I tell people this all the time when they ask me, you know, well, I don't know what I don't know. Well, make sure that when you go through the list as you're calling and doing your, you know, shopping around, make sure that you ask the agency whether they're licensed, what type of license, what organization in the state is there, provides the supervision and oversight for that agency. Because I think that'll give you a lot of good basic information. I think that there's a lot, I find with some consumers that there's a certain amount of sticker shock that takes place when, and it's, for a long time, I thought it was just when I would have to tell someone, a family member, how much care, you know, they say, well, how much do you charge for care? And I give them the dollar amount. And then I felt like I needed to have those defibrillators handy because that person, the consumer, had just passed out on the floor and I needed to revive them. And I'm not exactly sure where that comes from. Like, how is it that people don't have, I guess it's a result of the industry. I guess we haven't done always the best in telling people how care in the home it's not inexpensive. And it's not, I think people have this imaginary idea in their head that it's compared to institutional care, it must be so much less expensive. Well, it's not. The reality is that you're asking trained professionals as a group, as an agency, to come into your home to provide a very personal type of care, from total strangers to a vulnerable person, vulnerable people who are ill or disabled. And so you want to make sure that the individual that's coming into your home to take care of your mother is someone who's being paid appropriately, is working the right amount of hours, that is the right training and the right supervision. I think a lot of what I hear from consumers when they talk to me about the problems, they're calling to complain and they're trying to find another agency, et cetera, et cetera. A lot of it comes down to poor supervision. And that's what I think you want to make sure that you're looking for an agency where they're going to tell you how they supervise, what methods they use, how do they do their hiring, do they do criminal background checks? I let people know all the time that we do pre-employment drug screens. And that we, I introduce myself. Some people don't get it, but some do. And we become fast friends. But I always say, have you ever heard of helicopter moms? And those are the moms that are on the soccer field, hovering over their kids, making sure that they're doing everything right and hollering from the sidelines. And I say, I'm a helicopter social worker. And what I mean by that is that we in our agency, we get very involved, sometimes probably too involved, to make sure that problems are identified and rectified and that communication is clear. I think, some of the things that I've heard consumers tell me over the years, like I've had consumers say to me, I called you. Somebody said to me once, I went down a list and you were the only person that out of like 6 phone calls where you answered the phone by a person. A person answered the phone. They had to leave messages, or nobody picked up the phone, or somebody picked up the phone, but the message was, nobody's here right now, they'll have to call you back. So I think that making sure that as a consumer that you choose agencies where there's good, solid communication and you feel like you can trust them. And that's another big issue. You need to have, I tell our clients that a lot of what we're looking for is the building of relationship. We're trying to build relationships with our clients and our families. And that's where, you could talk about, statistics and data and all that other kind of stuff. But when you get right down to it in this business, it's about relationships. I've been doing this for 28 years, Marilee. And to me, it's a pretty simple, well, actually it's very complicated, but it's a cut and dry issue. It's about relationships. So when a consumer gets a good feel for the way someone is talking to them on the phone, that they've returned their phone calls or their messages, if they're willing to go out and meet them person to person. And with COVID, that has been really challenging over the last year and a half. It's getting easier. And I always tell people that, I want to meet you, or I want you to meet people from our agency, because I want you to kick our tires. We're going to come into your home and we're total strangers, and you're allowing your vulnerable older adult who you care for, who you love and want to do right by, and you're bringing in a total stranger who you've never met. So the first thing is to really, I think, establish the relationship with someone, make sure that you get a good, warm feeling, that you can tell the communication is going to be good, and that they're upfront and honest with you. During COVID, one of the things that I've been telling our consumers who've been calling, and I've been doing this for 29 years, and I never thought I would be in a position to have to tell consumers how the sausage is made. And what I learned early on in COVID was that I really needed to just be honest with people about what all the problems were. Yeah, you're right. We're not going to send in somebody who doesn't use PPE. We're only sending one person in. We're doing specialized training. Our nurses available, but we'll only do Zoom calls instead of coming out into your home. We're minimizing the amount of, or eliminating our caregivers going from home to home. They go to one client and that's it. We don't double book them. And so the more I was just honest with consumers, I had to be, because I wanted people to know that this is a serious business during this pandemic and required a whole different kind of outlook. I think consumers are still a little skittish. That's my read on things. I do think that I've noticed that there's an increase, at least in the Chicago area, with people choosing home care over assisted living or skilled care. There's a lot more that we're getting a lot more interest from people. There's a lot more people finding us from the internet, which has changed. I think that anytime you engage in this type of relationship, I think you need to understand that you may not have to be in the home 24 hours a day, 7 days a week, taking care of your loved one, but you're going to need to be present in the process. And that means that you're going to have to keep an eye, you're going to have to call, you're going to have to communicate, you're going to have to say, if something is not working well or it's not right, you need to call. You need to call the office and be upfront with people. Don't let things, be unresolved. So you do still, some of your worries will be taken away, but then some of them will remain. And it's important to stay engaged in the process.
I want you to thank you. That was very thorough. But I would like you to be more specific about staying engaged in the process, because I'm assuming if someone comes to you with fatigue over caring for a loved one and they have reached out to you or to another agency, what is a level of engagement that doesn't impact the care negatively from the agency side?
I listen to people. One of the hardest things I've had to do over the last year and a half, Marilee, I'm a social worker by training, which makes me a little different from most agencies, home care agencies. And it gives me a different vantage point. And what I've seen over and heard and been involved in has been, in the last year and a half or 2 years, has been some of the most pain I've heard our clients be in. The emotional pain that, it wasn't unusual for me to get a call at 6 p.m. at night with a daughter who was terrified of bringing her father to the hospital or bringing them home from the hospital, crying because she couldn't figure out where to go, what to do. And I think that the onus is on the agency, to be honest with you, I guess is what I should say. When families come to us, they are usually in such distress. And with COVID, it's distress times 10. And all of the healthcare systems that have been in place really have broken down worse than we all knew they were broken, but it really broke them even further. And so more and more consumers were calling us and totally in the dark about what to do, with terrible stories of incredible responsibility for ill family members sometimes they were calling, they were living in New Jersey and their parent lived here in Chicago. It was just all over the map. So I think that the onus is on the agency to be respectful and patient and understanding when families are engaged. That's how you get to know them. That's how you build a relationship with them. And even sometimes if it's a little overkill, well, you deal with it.
So we're still not out of the woods yet in terms of COVID. There are still hot spots and different questions about what should one do and not do. So from a care in the home perspective, which obviously has become more important and more preferred because people don't want to go to a congregate setting, how do you see this playing out in the future? I know the staffing shortage is an issue. So is there something that you have done that makes it easier to staff or easier to monitor your cases in this time?
Well, there's several questions in there. And the first one is no. Is staffing any easier for us than anybody else? No, it isn't. It is the worst that I've ever seen it in the 29 years that I've been working. And I only expect that to continue. And I think with that, and that's actually what led me to start thinking about the whole idea of, I read a lot in the industry about recruitment and retention, and people were talking about, giving things to caregivers and giving them, $500, giving them gift cards, all of them very nice and important things to do. But the problem that I saw with it is that nobody was talking about a true investment in our workforce, which is to really understand that this is a workforce that has been underpaid and overworked and has been not seen as it's not been afforded the dignity that the work that they do should demand. And so I've been working on a project to bring together a group in Illinois to look at expanding the scope of CNA practice. And that was, I considered a lot of different things, but I was able to I worked and thought and tried to talk to people, and I read things. And it struck me that one of the ways that we could build, a ladder of, a job ladder, the way we could enhance the skills that most CNAs already have to begin with, just by virtue of who they are and what they do in the home. And taking a look at staffing shortages, particularly if you take a look at, the shortage of nurses, it's really no different than when we've seen the shortage of physicians and industry created physician assistants. So I'm hoping to take a really close look at and be able to make an impact in the expansion of the use of CNAs in a home care setting to do things like be able to administer medication, to not only just remind someone, but actually be able to hand them medication or to give them a shot. All of those things currently, at least in Illinois and many other states, are prohibited. And I think what that has a sort of a double edge. It's like a two-way street. They run parallel with each other, and it provides the CNA with a ladder to go up and to earn more money and to build on their skills that they already have. And it also allows care that's the higher acuity or the more complex care needs of people now as hospitals struggle to do whatever and people aren't going into long-term care facilities. Those clients can be cared for with a higher level of worker in the home. So that's how I've worked out my frustration through this pandemic, is to come up with that idea and see where I can take it.
Well, it certainly sounds like it might be one solution to this ongoing staffing issue. So, Sheila, there are a lot of things that are going to have to change in the industry in order for us to meet the growing needs and demands as our population ages. So you are such an industry expert. Is there anything that our consumer audience could do to make it easier to find care? I mean, I know supporting you in this endeavor in terms of expanding the scope of the CNA, but what other kinds of things could a consumer do to assure that they will have care when they need it?
Well, the things that come to my mind are the sort of common sense things. I think word of mouth. I've noticed that more and more people who call us are saying, I got your name from so-and-so who you took care of their father. And so I think that people's social networks can be very useful as places to go to look for referrals or good experiences. So-and-so had a great experience with so-and-so agency. And so you check in with your network and find out who they're recommending. I think that, being more aware of what's going on in the healthcare world, I think talking to your physician, talking to your nurse practitioners, any of the people who you're in contact with from the healthcare community also, I think, could help you find recommended agencies or good experiences. I can't think of anything else.
My last question for you, which I always end these interviews with, is, was there something you thought I was going to ask you about today that I did not, or something you would like to offer our audience in terms of a closing?
Well, no, I had a pretty open mind about what you were going to ask me. So I don't think we missed anything. I think that my advice to consumers is this is going to take a while for things to sort out and straighten out. And so I would urge people to be patient but diligent and to make themselves become experts in this area. If you or a loved one anticipate the need for care in the home, and that's what you want to do, maybe it's not today, maybe it's 5 years from now, I would highly recommend you get as much information, talk to as many people, and really get a sense of what the industry looks like outside your doors.
Well, that was just a great advertisement for the Help Choose Home podcast, because now in its 4th season, that's what we've been doing. So I appreciate that plug. Sheila, thank you so much for your time today. You're such a well-respected industry expert, and you've done so much to make this industry better and more consumer-friendly. So thank you for your time today. Thank you so much for listening today. And a special thanks to our sponsors and partners, National Association for Home Care and Hospice, Access, and Core Cubed. If you have not done so already, please subscribe to our podcast and take the time to leave a review on Apple Podcast. We are now also on Spotify and most other places where you find podcasts. Like and follow us on social media and join us, won't you, to spread the word and help choose home when care is needed.